Hi, Ghazal. Very good morning. Welcome to the Future Doctor podcast show.
Thank you so much. Good morning to you too.
Welcome. Just to give you a background about the podcast, we do this podcast with international students from top medical universities to give hands-on information to high school students and their families to know about how to apply to medical school, how is the life of a medical student, and what are the future opportunities after you graduate from a medical school.
Okay.
I'm very excited and looking forward to speaking with you and understand your journey, and hopefully the audience will benefit a lot from it.
Thank you so much for having me today.
Great. So let's get started and let's
Okay.
dive right into it. Tell me a bit about your childhood, your education, high school, you know.
I was born and raised here in Dubai in the UAE. All my life, I went to Al Mawakib School Al Barsha. I graduated from there, and then I went to Mohammed bin Rashid University of Medicine and Health Sciences, MBRU, and currently I am a final year medical student there.
Wow. So in
Yeah.
just few months, you're going to be Dr. Ghazal.
Yes.
Congratulations in
Hopefully.
advance.
Thank you so much. Thank you.
Great. So you're a Dubai girl. You're born, brought up here.
Yes.
Amazing. So, my first question is, when did you realize you want to take up medicine as a career?
So I graduated high school a bit early. I was only 16 years old.
Wow.
And none of my family members are doctors,
Mhm.
and neither of my parents are. I don't have any uncles or aunts or any relatives that are doctors. So I thought to myself, I was like, why shouldn't I be the first one in my family?
Hmm.
And it was a nice opportunity because my university, which is MBRU, opened 2 years before I graduated. So it
Okay.
was still the new thing
Okay.
in Dubai.
Hmm.
And I thought to myself, let me apply and see how it goes.
Hmm.
So I applied, and thankfully I got it accepted. So I went with it, and I'm happy with my choice.
Okay, so tell me, during your grade 10 or grade 11, were you confused between multiple career choices, or were you sure that, medicine is the thing for me, or you were considering engineering also, or business also, or other courses?
No, honestly, just like every other high school student, I was confused as well. I didn't know what I wanted. I wasn't sure of medicine.
Right.
I think that's the best way to put it. But then what I did was that I took multiple AP courses, and I tried to explore every course I had just to see what I liked and what I disliked. And I took AP Calculus, AP Literature, and AP Biology.
Nice.
And from those, I really liked AP Biology and the human body and how it works. So I think this was one of the triggers for me to even apply for medicine.
Okay, so AP Biology was the one like you really liked, and that inspired you, like probably caught your interest that you should pursue biology further, yeah? And
Yes.
that's where you thought medicine is the thing for you.
Yes.
Amazing.
I would say that.
So for students who are taking American high school curriculum, or probably thinking of taking American high school curriculum, can you explain them what is AP Biology and a regular biology subject? What's the difference like?
So the difference between normal biology and AP biology is APs are usually college courses, so they're college level. They're a bit more difficult than the normal high school courses, but you take them to challenge yourself and to see what you would get into college. Basically the whole idea of them is to introduce you to college courses and see what you like, and based on that make your decision in the future.
Fantastic. So they are more college level, so they sort of prepare you for college already,
Exactly.
right?
Yeah.
So for a aspiring medical student, what AP subjects would you recommend them, that they should take?
I would definitely say to take AP biology. There's a lot of human anatomy in that.
Absolutely.
I would also recommend AP chemistry because a bit of the foundations of medicine, the first year you're going to take a chemistry course. So it does give you a bit of an idea of what that is. And I think that's it. These are the most important two courses.
See,
you can
biology and chemistry.
take. Yeah.
How about mathematics or calculus? A lot of medical students run away from, say, maths or physics. What do you have to say about that now? Considering you've already done 6 years of medicine, so how much of importance maths and physics is?
So as someone who's studying medicine in the UAE, I don't think it's that important because I haven't used math ever since I graduated high school.
Wow, okay.
Yeah, I didn't have any elective courses in math, or I didn't have any course that involved math or physics or any engineering course. But I think if you would want to study medicine outside, in the US, in the UK, you do get a bit of courses in your pre-med time.
Okay.
Yeah.
Did you have a subject called as biophysics in the first year?
No, in my university they don't
You
offer
did not
that.
have.
No.
So you did not have element of physics in your first year or
No.
second year. Okay, amazing. So you could kind of bypass maths and physics requirement.
Yeah.
Amazing. And to validate your interest, you said like AP biology was something that you really liked and that caught your interest. But you did anything beyond your high school to sort of know if medicine is the thing for you? Did you do any internships or shadowing at hospitals or met doctors? How did you know, okay, this is something I can do my entire lifetime?
Honestly, I watched YouTube videos and TikToks of actual residents and medical students in the UAE and outside. So I saw like a day in the life or what they do on a daily basis. I tried to get an idea of what to expect if this is what I want to choose. And I really liked how the dynamic was, and that's why I chose it to be. But I didn't do any internships. I didn't have anyone that was a doctor that was close to me.
Right.
I could do that.
But would you say in hindsight, looking back, is it important to do internships in your senior years, like shadowing doctors or volunteering? Do you think that those are important?
Yes, definitely. I think it would help a lot because it would give you a clear image because you're actually living it. You're not only watching it behind a screen like a YouTube channel. I do know now that in the hospitals I rotate at currently, they do offer high school students, and I see a lot of high school students rotating with some of the doctors and shadowing them.
Right.
So I think it's a really nice idea.
Right. And do you mentor students, say if your high school students or junior students approach you, do you like guide them, coach them, how medical student life is? And do you do that?
Yes, of course. I love tutoring, or not even tutoring, just talking or giving advice to the younger students. I think the best way to learn about someone and what they're going through is just to ask someone who's older than you, who went through the same experience.
Right. A lot of students from the UAE, right? You graduated in 2018. That time there was a big trend of going to the States or Canada or to the UK or even to Australia, right? That was typically the trend for students going to medical schools. Why did you decide to stay back in the UAE? What are the benefits of staying in the UAE? And tell me your reasoning, of continuing the education in UAE itself.
So I was initially planning or thinking about going to the US. I do have some family members who live there. But again, I graduated at 16, and personally, I didn't feel like I was ready to go and move to another country alone. I was too young and I didn't feel prepared at all. And the system itself, I liked more studying medicine in the UAE because I found it to be shorter and quicker.
Okay.
I would rather do a full medical program, full medicine, 6 years of MBBS, rather than doing a pre-med and then an MD.
Okay. Can you talk a bit about that, the pre-med and MD? How does it work in the US? How long does it take, and how is the journey if somebody wants to become a doctor in the US?
So basically, if you want to become a doctor in the US, you have to go through 4 years of pre-med. You take a lot of courses about, you can even take math, electives, arts, theater. I think they take a lot of different electives, even biomedical engineering, biomedical sciences, stuff like that, for 4 years.
Okay.
And then you have to do an exam called an MCAT.
Right.
You have to pass the MCAT and then apply to medical school. So there's even a chance you don't get into medical school.
Right.
And then if you get into medical school, that's another 4 years of rotations, basically in the hospitals, being a medical student. And then in your last year of medical school, so that's 8 years, in the last year you apply to the post-grad specialties, or basically the residency programs.
Right. So totally it's going to take 4 plus 4, 8 years.
Exactly.
And plus you said after 4 years, they may or may not get the chance to get into actual medical school.
Exactly. So it's not guaranteed.
Right. So what I understand from you is age-wise, maturity-wise, you're not ready to leave the country, right? So what are the characteristics a student should have, or what are the things a student should consider when they want to venture out by themselves into a new country or into a university life? What do you think, looking back at your own life, what are the qualities a student should have to get into university life and sustain there and, be successful there?
So outside, if you want to go somewhere else, I think it's very important to be, one of the qualities that you should have is being responsible. I think if you're used to, Dubai in the end is a luxurious city.
Right.
You're very spoiled compared to other countries. You have everything easy. Whatever you need, you can just order it online or something like that. Everything's accessible. But if you want to live in another country, I think you have to depend on yourself a lot. You have to do everything by yourself. You have to find the restaurant. You have to find the food you're going to eat today. You're going to have to make your own friends, depend on yourself. You're not going to see your family as much. So I think being responsible is one of the best qualities that you should have before leaving the country.
Right. And how university life has changed you, like from school to university? Although I'm presuming you live with your family, right?
Yeah.
Or you're living on campus?
No, I'm living with my
with
family.
your family.
Yeah,
Okay.
yeah,
So
I
just
live
getting
close.
into university, what changed for you? If you can, think about, how that first year of university and then grade 12 of school, what happened in between? What changed in you?
So I feel like I matured so much more. I spent 6 years on that campus and with the same people, with the same professors. I think it makes you grow up and it makes you think in a different way as compared to a high school student. I feel like I have met new people. I have made different interests now. I know what I want in, for example, a friendship or a relationship with someone. So I think it makes you grow up in that aspect mostly.
Right. And of course, you had to leave behind all your classmates, right? I'm
Yeah.
sure, you had like very deep bonds and relationship with your classmates. So when you go into a university, you are absolutely new in the classroom. So what do you think high school students should be prepared for to ensure that they are able to, quickly adjust to their classroom and to that new university life? How do they make, bond with other students?
I think it's very important to be open-minded and go into your university life not having a specific agenda or criteria for a friendship or a class or a professor. I think you have to be very adaptable. Once you go into university, that's a very important quality that a student must have, in my
Right, I
opinion.
absolutely agree with you. And talking about university choices, like now you are studying in MBRU, right? Mohammed bin
Yeah.
Rashid Medical University. But in the UAE, there are many other medical schools. So why did you choose MBRU? And did you apply to other medical school? Can you talk about a little bit about your application and admission journey?
Yeah, of course. So I applied to Gulf Medical University, and I applied to Ras Al Khaimah Medical University as well,
Nice.
and to MBRU. Those were my
Okay.
3 top choices.
Okay.
But honestly, once I got the MBRU offer, you first get an invite to an MMI, which stands for multiple mini interview.
Right.
And if you get the interview, then you have to go do the interview, and then they tell you if you are waitlisted or accepted or into the program or not. And once I got the invitation to the interview, I felt good after the interview. And once I got the offer, honestly, I rejected the other offers from
Offers.
Ras Al Khaimah and GMU.
Okay.
I got accepted.
Tell me a
to-
bit more, like what attracted you to MBRU? What were the things you were looking for that you found in MBRU and you felt like this is the university I want to join?
Honestly, just from the, I know it was a bit relatively new compared to the other universities. That was very scary because a new university, you don't know much about it.
Right.
It's still scary.
Correct.
But knowing how much effort and how much how many good qualities they're searching for in their students and the standard they put for their students, I think attracted me to that university most.
Okay.
I felt like they said it very clear in the beginning. We're looking for 40, 50 students in each batch, and we want only the top students. So it was more of a challenge for me, and knowing that they only want the best students on their campus is something that attracted me to that university.
Okay, so as a student, if there is more competition, if the selection procedure is more selective and you get through that, do you feel like, more attracted to that university? Yeah, competition is very high and if I get selected, probably it's a very good university.
Yeah. Honestly, that's what I felt, yeah.
Yeah.
I felt like just being chosen by them made me feel special and made me feel like I need to live up to the standard they are expecting from their students. So that's what happened with me, yeah.
Right. And did you have any written test at that point of time? Now, of course, 6 years down the line, a lot of things have changed. Still,
Yeah.
they have the panel interviews. Did you have any written test for MBRU?
No, when I was applying, they didn't have the entrance exam, but now they do have an entrance exam that you have to pass, then get to the MMYs.
So entrance exam plus the multi-mini interviews.
Exactly. Yes.
Right? And what were the grades they were looking for in the range, like 80% plus, 90% plus? What were their grade expectations from students?
So when I was applying, it was a 90 and above in all
Right.
the sciences. So in chemistry, biology, and physics, they needed a 90 plus. And I believe mathematics as well, they needed a 90 and above.
Okay.
That's for the American system. For the IB and the other ones, I'm not very quite familiar.
Right. Obviously, I advise students to keep checking with us, with Gyanberry, or with the university on the ongoing admission requirements, like, so they are up to date
Yeah,
with the
exactly.
requirement. Can you talk a bit more about the curriculum of the med school of MBRU? Like, I know it's a 6 years course, so what exactly happens during the 6 years?
So it's a 6-year program. It's an MBBS, which is a Bachelor of Medicine and Surgery. And the first 3 years are called the preclinical years. So you study on campus, you get the lectures with the professors. And so you get a few opportunities to go to the hospital just to get, like a view of what's going to happen in the hospital. But it's very basic level. The last 3 years are basically called the clinical years, where you rotate at hospitals in Dubai and outside of Dubai with doctors. You get placed in specific places, and that's basically your everyday life. And you still have a lecture once a week on campus.
Can you talk about your hospital experience, where all you went in the UAE, which hospitals you rotated at?
So usually they send us to Mediclinic branches, Mediclinic City Hospital, Park
They're
View.
really good hospitals, yeah.
Yeah. So we get exposure to both private and public hospitals. But private include the Mediclinic branches at City and Parkview, Wellcare. The public include Dubai Hospital, Rashid Hospital, Latifa Hospital, and Al Jalila Children's Hospital as well.
Okay, and what kind of clinical rotations you had? Like, do you go through all departments?
Yeah, so they're divided into each year, the year 4, year 5, and year 6. But the majority is that you have to cover the big ones, which are internal medicine, general surgery, obstetrics and gynecology, pediatrics,
Right.
and then the subspecialties, of course. But these are the
Okay.
main big ones.
And what you do exactly in the last year of the clinical rotation? You're going to graduate, right, in few months. So can you talk a bit about the last year specifically? What happens in the last year?
Yeah, so MBRU is actually quite different than the other medical universities in the UAE. We're the only program that has our internship year as part of the program. Our last year, our 6th year. So currently I'm an intern considered, or a final year medical student more specifically. But our internship is integrated into the program.
Okay.
Whilst other universities like Sharjah and RAK and Ajman,
Okay.
they finish their 6 years and then they apply for an internship.
Okay.
So that's a difference.
So you sort of save that 1 year?
Yeah, exactly. And we're automatically guaranteed a spot. That's the
Wow,
benefit of MBRU, yeah.
Okay, okay. And how many students you have in the class? In general, say first year, how many students did they admit during your time? Because now maybe things have changed.
Yeah, now they're admitting a bit more than our batch.
Right.
But my batch, we are 48 students.
48 students. Now in the sixth year?
Yes, in the 6th year. We started at the first year, we were 72 students.
72.
And
Okay.
then with the years, of course, some stuff happens and some
Correct.
people leave.
Absolutely. Yeah.
Yeah.
So 70, it's a good proportion, like student to teacher ratio. Not bad.
Yeah.
Okay. And how many international students, are there in MBRU? Are like most of the students from the UAE, or you have students from around the world?
It's actually quite diverse. We have a lot of international students. A lot of them moved from Africa specifically.
Okay.
I have around 7 or 8 girls in my batch that are from
Nice.
international students. And I really like how diverse our university is. They accept people from all over the world.
Amazing. And like, do these international students stay on the campus? Like, do they have dorms, or they have to like look for apartments or something by themselves?
Some of them find apartments by themselves, and some of them they go with the dorms of the university that they provide. Yeah.
Okay, okay. Tell me a bit more about the studies. How many hours did you study, say, in the theoretical years, say, first 2 or 3 years, and how many hours do you study during the clinical years as compared to your high school studies?
So I would definitely say that I study more in in the university compared to high school.
Absolutely.
And specifically more in the first 3 years, because when you're doing basic sciences in the first 3 years, you need to get a really good GPA to start with. You need to have a strong push, and the courses are usually a bit more difficult because you're taking biochemistry, foundations, the basic courses. But then with the years, you start getting more into anatomy, clinical sciences, and integrated sciences, which is just easier because it's more logical than just memorizing and knowing the courses.
Right. Yeah.
So
number of hours, right? Tell me a number. How many hours you study every day? Is there a fixed timetable that you have, or it really varies?
It really varies for me. I'm not someone who, ideally you should be someone who puts a schedule and then say for yourself, like, from this time to this time I want to do this. But usually I would say around, at least you need half an hour per day, at least. Half an hour to 3 hours is very ideal.
Half an hour to 3 hours beyond your
Per day.
university life, right? Like university classes and all that, correct?
That's for the university itself. So the first 3 years, half an hour to 3
3
hours
hours
is
daily?
ideal. Yeah, daily.
Okay.
Daily.
And is first year more intensive? Like, do you need more preparation in studies? Because high school, say you're coming from American curriculum, is not that intensive, right?
Yeah.
But say first year of med school is very, very intensive.
Yeah.
So did you put in like more hours during the first year?
Yeah, for sure, because also the transition was hard from high school to medical school.
Right.
So to get used to the system and how the university works, I did put a bit more effort in the first few years. Yes, definitely.
I can see that you are probably a very fast learner, because when I spoke to other medical school students, they are like 4 hours, 6 hours every day they put in. But again, they said it
Yeah.
really varies what's your comprehension level, and your study style,
Yeah.
So
I
that's
think
great.
if I could give one advice to our listeners today, I think something that's very beneficial in medical school, and it took me 6 years to
Right.
learn, but I think the best advice I can give is to go to class prepared. So at least read a bit about the lecture, because they do provide it for you on like an online platform.
Right.
So just go over the slides or the PowerPoints that you're going to be discussing today, even if you have no idea what it is, but at least know the title, what they're going to talk about, the learning objectives. And when you go inside class, you're attentive, you're going to retain 70-80% of the information.
I think that's an
all you
amazing
need.
advice,
Yeah.
right? So you prepare before the class,
Yeah.
and then you again revise after the class, right?
For sure. I think that's very good.
Amazing. Tell me about the examination system in MBRU. Like, is it like written exams or oral exams, or is it a mix? How do you pass the first year and go to second, and so on, so on? What is the assessment criteria?
So usually they have both written and practical exams. For the written, you can have a mix of short answer questions and multiple choice questions. And in medical school, generally all universities around the world, they have something called an OSCE, which is a practical exam.
Okay.
You go to multiple stations, and then you go inside, you have a standardized patient, or basically an actor,
Right.
and then you have an examiner as well, and then you pretend that this is your patient, you introduce yourself, you see what the problem is, you take a history, you examine your patient, and then the examiner usually asks you a few questions about that.
Okay.
So that's something different than normal other universities.
Right. And during the clinical years, how are you assessed? How do they assess that you've passed the third year of the clinicals and you're going to fourth year? Is it the same thing?
So yeah, we still have the OSCEs, and we have the short answer and the multiple choice questions.
Okay.
And we have a lot of assignments and submissions, case logs, case presentations. They like a lot of presentations in the clinical years.
Okay.
So you're expected to present patient cases, whatever you've seen, something that's interesting. Every once in a while, they do expect you to present something like that.
Okay. And say, what happens if you fail a subject? Are you allowed to repeat that subject in the same academic year? What happens?
Yes, usually you're allowed one chance to repeat
Okay.
at my university, and then after that, you unfortunately have to repeat the year.
Repeat
if
the
you
year.
don't
So
pass.
you've got, say, 2 chances in total.
Yeah,
Okay.
exactly.
Okay. Now, what's your plan after you become doctor, right? I believe you're going to be, say, qualified doctor in just
Yeah.
few months, right? So congratulations in advance.
Thank you so much.
Right. So what's your plan? What do you plan to do after this?
So usually after medical school, you have to specialize and get into a residency program, whether it is here in the UAE or outside. For myself, I want to specialize in dermatology.
Okay.
I'm still looking at a few programs, but I can give advice about the residency here in the UAE and the programs here. So here to apply to residency programs, you have to pass an medical licensing exam, which is called the EMRI.
Okay.
It's just questions about everything in medicine. If you pass the exam, you're eligible to apply for whatever residency.
Can you talk about this exam a little bit? Like what's the format of the exam? How long is it?
It's 3 hours, and currently the only place that provides this exam is in Al Ain in UAE University.
Okay.
So you have to go there and then take the exam for 3 hours, and it's all multiple choice questions.
Okay.
If you pass the exam, you apply for whatever specialty or program you want. So all these programs are actually under MBRU or Dubai Health now.
Okay.
And for example, let's say you like dermatology like myself, you apply to the dermatology program in Dubai.
Okay.
Versus in Abu Dhabi, you can also apply, and the EHS, Sharjah and those stuff.
Wow.
So it's a whole different program. It's like post-grad, and it's like medical school, but something else. But it's also you apply by program, and you put your preference, so your first preference, your second preference, and you see if you get an offer or not.
So you finish your MBBS degree, you give this license examination, right? Then you apply for specialties.
Yes.
You typically apply for 3 specialties, and you see where you get the place.
2, yes. Yeah.
Okay, so imagine you get accepted for the place, say for dermatology, right? How long the specialization is going to be?
So it depends on the specialty you choose. Most of them are 4 years, but if you're doing, for example, plastic surgery or a surgical subspecialty, it could be 5 years.
Okay.
Yeah.
And you have to do it at the same university where you're studying, or you go to another university? Does it really depend who accepts you?
So it's actually one unified system. It's under Dubai Health or MBRU, but it's not in a university. It's in a hospital. It's a program. And if you get accepted, they give you, it's like rotations again, like clinical years. They give you, they assign you in a specific hospital, and then you rotate in other hospitals in that specialty.
Okay. And if I don't want to become a specialist, right? I want to become a doctor, and I just want to start working as a physician. So can you talk a bit about that? Do I need to still give that license exam and then apply for jobs in the UAE, or do I need to do some further residencies or internships before I can practice by myself?
So obviously you need to finish your internship here, and then you have to still take the EMRI exam, and then you can continue the route of a GP or a general practitioner. You can do that, yes.
That's possible.
Yes.
Right.
It is.
And do you have any plans to go to the US or UK? And what would you advise if, say, somebody graduating from the UAE and wants to go to the UK or US for the specializations? How does it work out for them?
So I actually went to the US for a month. I did my elective there. I did it in Michigan, in Detroit. And I got the opportunity to live with the doctors there in the dorms, live in the hospital, experience it everyday basis. And the US route is different because if you want to specialize there, you have to take the US MLEs. Yes. And there are different exams. There are 3 exams, step 1, step 2, and step 3.
Right.
And you have to pass them and get really good grades. And it's a bit competitive for IMGs, or basically international medical graduates.
Yeah.
Yes, but it is a very good specialization there, and their programs are excellent.
Right. Well, thanks for that advice. Finally, what advice you would give to someone, who is in the high school right now, say in grade 11 or 12, or even to your younger self, who is planning to apply to medical schools or want to embark on a medical, journey? What would you tell them in general, to set up for success?
I think something that's very important to keep in mind is to have faith in God, and to not overstress, because a lot of high school students, they say, oh, I want to be a doctor, I have to get the best of grades, I have to stay on my A game the whole time. I think if you just relax and go with the flow, and just be sure of what you want to do. I think that's the most important thing to succeed in life. You don't have to be always stressing and over stressing about what you want to do. Just relax, go with the flow, and in the end, it's going to work out for everyone's favor.
Amazing. I had actually one more question. There's a rumor around that medical students, they don't have any social life. How much truth is there? Like, do you guys have social life? What would you tell someone planning to pursue medicine? Because a lot of students run away. They feel like medical students don't have any social life. They just college study. That's it, right?
Yeah.
Is that true?
I think for me, definitely it's not true, but I think it just depends on the person. I am someone who had that fear in high school because I'm a very social person. I like going out with my friends and family. But getting into medicine, it was scary knowing that I might not have a life or a social life. But once I entered, I was still living my life. I still go out with my friends. I still make sure to keep time on the side for these things, because if you don't, you're gonna crash at one point and you're gonna burn out, and it's not good for even your mental health for university.
Absolutely. So doctors party, right?
Doctor's party for sure.
Right. So with that, we'll end this podcast. Ghazal, thank you so much. I'm very sure that these your journey is going to inspire a lot of students, and I'm sure if you can do it, a lot of students can do it.
Thank you so much.
And they will learn a lot from this podcast. Thank you so much, and wish you all the best.
Thank you so
and
much.
looking forward to seeing you as a dermatologist very soon.
Thank you so much.
Right. Thank you.